Welcome to the Wava Circle, real talk on fertility, wellness, and trying to conceive. I'm Gabby Paychev, founder of Wava Health and fertility educator. This podcast is your community space for navigating the path to parenthood with evidence based insights, authentic conversations, and genuine support. I'm dedicated to being here with you through every part of your journey. Aimee Ruiz is a licensed acupuncturist and herbalist in Northern California, where she leads two teams of acupuncturists, East Bay Acupuncture in Oakland and Needle Wellness in Petaluma. Her teams specialize in integrative fertility, pregnancy, and postpartum care, supporting people of all genders throughout the reproductive journey. Welcome, Aimee.
Thank you. It's great to see you.
So let's start at the beginning. For someone who's totally new to acupuncture, what is acupuncture and how does it work from a traditional Chinese medicine perspective?
So, acupuncture is a healing practice in traditional Chinese medicine, and we're also using the term East Asian medicine to honor and encompass all of the countries that have practiced these traditions throughout thousands of years. Acupuncture uses thin, sterile needles to affect change in the body in what we call in Chinese medicine qi, or your life force. So, what we're doing is using these channels of communication throughout your body to bring it back into balance and create what we would look at as harmony. That's the Chinese medicine definition. And then we can broaden it to like more of a Western medicine idea, which is it's all about circulation of energy, circulation of fluid, of blood. And what we're trying to do is just bring the body into balance. And we're speaking to the nervous system and to all the systems of the body. And we can use these channels of communication to do that. And specifically, when we're thinking about fertility, there are channels that go to the reproductive organs and the pelvis that can help to optimize and increase fertile capacity.
Acupuncture was a really important part of my fertility journey. I remember I was reading studies, it was showing how it helps, like you said, with improving blood flow to the uterus, balancing hormones, reducing stress was definitely what I saw, I noticed.
Yeah.
And I wanted to give it a try. And I tried a few different places at first. And I quickly realized that not all acupuncturists are specializing in fertility. And not all offices feel the same. They're not all calm and welcoming. So it's very important to find the right one. I really wanted that dark, quiet, cocoon like environment.
Mhm.
I really loved it. It was really, really probably the most calming and beautiful experience I had during this stressful time.
I love that. And that's one of my favorite parts of acupuncture is that it regulates the nervous system and it has this calming effect, brings us out of that sympathetic nervous system fight or flight into this restful place, which is where like the healing actually can happen when we're in that restful place. So I'm glad that you had that experience.
I know a lot of people get scared. Acupuncture often gets a bad reputation for being painful because people get scared of those needles. And do you want to talk about this? You did mention they're very small, they're hair thin needles, so they don't hurt.
Yeah, I think in our society, we have experiences with needles, and those are either getting a shot or getting our blood drawn, or some people have tattoos or something like that. But the most common experiences that people associate with are experiences of pain, especially as children, that they like bring with them to the treatment room. So it's not uncommon that people are nervous. It doesn't hurt. I would say that you do sometimes feel like a teeny tiny little pinch, but they are, like you said, hair thin, tiny needles. Most people find it super relaxing, as your experience was as well. You might feel like the tiniest sensation. I had a teacher once who talked about how in modern society we're the idea of a sensation is really related to pain, and feeling something doesn't necessarily mean that it's pain, but you might feel like a little something. but it's not painful and it is relaxing. I think most people really enjoy it.
Yeah, it was definitely one of the few places where I could truly relax.
Ah,
And sometimes you do end up drifting away, snoozing away a little
yeah.
bit, which I didn't expect because I don't fall asleep very easily. But what is unique is that you're left alone in this dim, quiet room, usually with soft music in the background. It's very peaceful, but it's also very emotional for some people because you finally have this moment to just be with your thoughts. And for some people, that can bring a lot. And when you finally find a really good acupuncturist, someone who understands fertility, who knows how to create a nurturing space, it makes all the difference.
It's so true. Yeah. Hopefully you find that person. And there's an acupuncturist for everybody. So, depending on their personality and the acupuncturist personality, finding the right fit is so important. And like you said, finding someone who specializes, but the ability to hold space, I think, goes so far, especially in the fertility journey, getting to have a place where you can, I say this many times a day or a week, is like your tears are welcome here. Like you get to share and bring your whole self to the treatment room. And I think that's just such a lovely way to support people. And then we get to offer these amazing tools to people, and you get to experience that by yourself. And yes, it is sometimes activating or emotional to be able to drop in. And that's part of where the work is, right? Is our
Yes.
helping us connect with our bodies and connect. There's in Chinese medicine, there's a connection from the uterus to the heart. So even just being on the table with one hand on your heart and one hand over your lower abdomen is facilitating that. Like we hold so much with this experience
Yes.
when it conceived in our hearts, and it can create a lot of heartache and stagnation and anxiety. So being able to sit with that, helping our body to let all of that go is always beneficial, right? Most people come out and they're like, "Oh, I really needed that."
100%. Exactly. Because we oftentimes we hold these feelings inside. And it's finally this time where you can let go, you can accept those feelings and let them out. How did you personally get into acupuncture and fertility work?
I was going to be a social worker and a therapist, perhaps. And I had a really great acupuncture experience. And when I got to graduate school, I realized that social work and therapy wasn't the right avenue for me. And so, through a series of events, I found acupuncture, which I had previously a really amazing acupuncture experience for some health issues I was having in my early 20s. And it was this light bulb moment of, oh yeah, I can do that. And one of the things that I loved about it was, of course, like the holistic part, the spiritual part of it, but also just that I could give somebody something. So I get to still hold space for people in a way, and then I get to offer them this beautiful thing that helps them heal and get to their fertility or family goals. It's just a sweet way to be. And then in terms of becoming a fertility acupuncturist, when I was a student at my acupuncture school in New York, we were at a hospital and we actually were in labor and delivery department. So we started learning acupuncture during birth, and that brought me through this like whole like fascination with pregnancy and birth. And then when I started my practice, I started getting fertility patients, and I realized I needed to learn to be able to meet that need. So I started a whole certification process, and it's called ABORM, Worldwide Certification for Integrative Acupuncture and East Asian Medicine Fertility Care. It's a lengthy process of education followed by a rigorous exam to become a fellow of that board. So I started myself on that process, and then I also got a mentor to help me learn more about fertility care as an acupuncturist. And so now my practice encompasses both of those things, fertility and pregnancy, which I love to be able to support someone to get pregnant and then get to support them throughout their pregnancy. You mentioned like first trimester, so much comes up, especially during having gone through IVF or fertility struggles. That first trimester and sometimes throughout the whole pregnancy can feel really anxiety provoking. So being able to support people through that is my favorite.
Yeah. Well, thank you for all the amazing work you're doing.
Thank you.
Are
Yeah, I love
you
it.
you work with a lot of people who are trying to conceive? How does acupuncture support reproductive health?
So acupuncture, we talked about circulation, is helping to bring as much blood flow as possible to the ovaries and the uterus, which are going to help with uterine lining and egg quality, as well as help with hormone balancing, so regulating ovulation. We talked about the best part of acupuncture, in my opinion, is helping to regulate the nervous system and reduce stress and anxiety. We're also thinking about people as whole beings. So we want to make sure that all of their systems are working properly so that they have the energy and capacity for reproduction. So we want to know about their sleep and their digestion and their energy and any other health issues that are going on, because we want to help bring those back into balance and have them be in as best health possible to then come into a pregnancy in best health possible.
So you touched on whole body. So how do you blend acupuncture with lifestyle, nutrition, herbal medicine in your fertility care model?
It's so important. They're only in our office 1 or 2 times a week, and the rest of the time, our patients are out in the world. So, diet, lifestyle, meditation, thinking about supplements, we are always coming up with a really cohesive, individualized plan for people to then take out into the world and hopefully be able to create good, healthy habits for a future pregnancy.
Now let's move to male fertility because this isn't talked about as much, especially in the acupuncture world. Maybe from your side, you know a lot, but from my side, as a patient, when I did acupuncture, nobody mentioned or said anything about my partner, my husband, who could potentially also benefit from acupuncture. So we know that male factor infertility and sperm health play a really big role. Up to 50% of fertility challenges stem from there. So why do you think this gets overlooked and delayed in evaluation?
Oh man, it's such a big topic. There's so many things. I think we as a society have put this pressure on the person that's carrying the pregnancy, traditionally on women, because it's happening to them. So the male partner or the partner with the sperm has this level of detachment from it that it's not really happening to them. They've contributed to it. But when someone, even throughout time and history, if the woman or the person trying to carry couldn't carry, it was always considered her fault or their fault. And so we've done fertility a disservice by continuing that story. What I want to do and what I'm trying to do, and even in the fertility acupuncture world, we are focused a lot on female fertility, on the person carrying the pregnancy. And it has been one of my missions to try to change that, because there are two ingredients, right? And so if we can break that stigma and bring the other partners into the conversation, I want that to mean that people get pregnant faster, right? We get to our goal and people take responsibility, that they're both there doing this as a team. Maybe also a lot of our research was done by men. The same way that women are told that their worth comes from being able to have a baby, men are also given that message that if they're not able to, either if their reproductive organs are not functioning properly or they're not able to have children, that means something about who they are. So I would like to break these stigmas and have there be a more cohesive partnership. If people are trying in a partnership, that people come together knowing that they can work together because there are two ingredients to this puzzle.
100%. And another thing is when, even when the problem comes from, let's say, a poor sperm, I don't want to call it bad sperm, but let's say the sperm parameters are not so good, and usually the woman still has to go through IVF, so she still goes through all the hormonal treatments. So I think that's another thing that kind of adds to the assumption that it's the woman's responsibility. It's the woman who needs to get most of the treatments out there. Do you think that it's only when there's an issue with the sperm test or with the DNA fragmentation? Or would you say that in any case, it will be beneficial for the partner, for both partners to get acupuncture, regardless of who has a diagnosis or not?
I do. And it comes back to that same thing, right? There's 50% on each side that are contributing to this hopefully healthy embryo that's going to implant and create a pregnancy. But that's the best case scenario. Yes, the same way that we see people in our clinic, mostly women, who come in with unexplained infertility, that can be the same for sperm health, right? Because the sperm, even if semen analysis is normal, there can be someone who drinks heavily, smokes marijuana, and somehow comes through with a normal semen analysis. Would my recommendation be to continue with that? Those practices? I would not. I would want to be optimizing their health and optimizing their sperm health so that they can get to their goal as quickly as possible. The same way that we try to optimize female fertility health, even if we don't know if something is wrong. People still seek out acupuncture even when they're going through IVF, even if there isn't a diagnosis. So I would say 100% yes, please come and get acupuncture and our guidance.
Makes sense. Makes sense, because sometimes you might have something that has not been seen or diagnosed. The tests, the normal ranges are not always optimal. You can't really test everything in your body, and you don't have to, but you want the most optimal environment from both sides.
Yeah.
What are some root causes from Chinese medicine perspective that you see?
In Chinese medicine, we're working on this channel system, and one of the channels that goes through and connects with our reproductive organs or genitalia is the liver channel, which is always fascinating to me when we think about if our liver is taxed and we have a lot of stress or we have a lot of environmental toxins or lifestyle habits that can stress out the liver, that affects our reproductive organs. One of the things that we think about a lot is the system of the liver channel. And we also think about, in Chinese medicine, things that are stuck and things that need to be nourished. So those are on two sides of the coin, but they can also come together. If things are not moving properly, then through stress, through tension, that can happen. But oftentimes it's more about the stress on the body and the things that are coming into the body that cause that liver, we call liver qi stagnation. Or even more than that, if there's like an underlying bacterial infection or STI or something like that's creating what we would call like dampness or heat in the body that creates inflammation. We want to help to decrease that so that the sperm have a good environment to grow in. On the other side of that is it may be genetic, it may be something nutrition related or gut health, that the person is not getting enough nutrients, and so then they're like, we think about the vitality of the sperm and what we think of as like your ancestral chi or the ancestral energy that may not be strong enough, that we can help to try to boost up to really give the sperm as much like life and nourishment as possible to do the job of transporting and fertilizing the egg.
You do talk about getting the semen analysis. Would that be a good first step before they come see you, or they can come see you either way?
They can see us either way. If they do come to see us, we'll send them to get a semen analysis, or they can get one. We can give them information to do that at home. I love getting a semen analysis just because it gives us a baseline, and then we can see after our work together what has changed, if anything needed to change in the semen analysis. It's one piece of the puzzle. We're looking at so many things, so it's a barometer of somebody's health, but it's not the barometer of their health like we had talked about previously. Thinking about diet and lifestyle every day is going to be affecting future sperm production. So we want to think about what they're up to today and help to support them. And then we can do so much, even without that information, to help increase blood flow, help with sperm production, as we talked about, and help bring their body into as best balance and optimal health as possible.
How about herbal medicine? Do you have similar approach for both partners or very different?
It's a little bit different in just thinking of each person individually. We're always creating a pattern that we see in their body and then treating them accordingly. That said, if someone was going through IVF, we wouldn't be giving them herbs, the person that was going to be going through the egg retrieval and transfer during their like medicated process. We can give them herbs before that to help support and prepare them. But with male partners, they're not going through all that hormone regulation and stimulation. So we have a little bit more freedom and access to do a lot of supplementation and shifting for them. We're not working with this, 28-day, 38-day, however many day cycle. Where men are constantly producing sperm. We have the ability to affect change pretty quickly. There's some studies that we can change sperm parameters even within 4 to 6 weeks. However, we know the life cycle spermatogenesis is around like 72-ish days. And so we always recommend people come in for 2 to 3 months for care. And within that, we can offer Chinese herbal medicine as something if they're interested.
And something important that you said that a lot of people don't know, and I want to say it again, it takes about, like you said, it takes about 70 to 75 days. So this is a very, very important window that you can utilize. And for women, it's also about 2 to 3 months, but it's slightly different because women are born with all of their eggs. So you might assume that there are certain lifestyle exposure throughout the years, even though the emerging research says that it's the most important window for women is also 2 to 3 months before conception. But for men, we know they make sperm every day. You have this window of 70 to 75 days. You can make sure you're at your best health, like do everything you need to optimize your health. This is such a huge opportunity. And not everybody gets to have that opportunity. Some people get pregnant easily. That doesn't mean that both of their partners have been in their best health. And they might be setting up their kids for, unfortunately, some chronic diseases. And now because your body is telling you, and your body is smart enough to tell you, okay, this is probably not the right time. So you should thank your body because it gives you signals. Listen to your body and basically take those necessary steps. Even if you don't completely overhaul your lifestyle, even if you take some steps to improve your health, it's still going to be so beneficial for you, your children, your grandchildren as well.
Mhm.
It's so
Yes, I
powerful.
wholeheartedly agree.
Do you see a lot of emotional resistance from men when it comes to acupuncture and being a little more engaged into the fertility care?
Yeah, it's difficult. I think it just depends on the person and the relationship dynamics and the if people are on the same page about their goals and how they want to reach their goal. Some people reach out. I have clients who are coming for sperm health and I don't even know their partners. It runs the gamut, but there just as we were going back to talking about the stigma around sperm health and what that means for somebody's manhood, and that this is looked at as a job that for the person that's carrying the pregnancy, we still have so much work to do in terms of our education and helping people to see that it's okay to ask for help and it's okay to care about your health, like you were saying. And so yes and no. There are sometimes people come in and they're like, I'm here because my partner told me to come. And then there are other people who are super excited and engaged and interested in Chinese medicine and acupuncture, and they are taking like a really active role in the fertility process. And I love to see that. But I'm here for both of those experiences, and I will support both of those types of people throughout the process. And I just love it when people are coming in and they really are, they want to give their all to the process. I think that it says so much about our relationship, and it also says so much for the future of their relationship and their family when people are
Yes.
on the same page.
Yeah, 100%. What lifestyle or nutrition habits tend to negatively impact sperm health that you help clients address?
Yeah, so there are the big ones: excessive alcohol use, marijuana, smoking cigarettes, recreational drugs, all in different ways affect sperm health by like from either, sperm count, sperm motility, sperm morphology, DNA fragmentation. We want to make sure that people are putting great things in their body because those are the building blocks of the cells of the sperm that are going to be hopefully creating a child. Most of the time, we ask people to abstain from a lot of all of those substances. The alcohol use in moderation is seen to be okay for conception. However, that's in moderation. 1 to 3 drinks a week is my like sweet spot, and we're here to support people wherever they're at. So if that doesn't work for them, then that's okay. But we give them the information that we have, and then they can use that however they feel like they can. We also think about oxidative stress and environmental toxins. So we teach people about things we know. Plastics are not great for us and they're everywhere. And if we can minimize our exposure to them, that's great for sperm health and for fertility. And then just thinking about, eating and getting vegetables and whole foods and making sure that your body has that fuel and, like I said, the building blocks to create good material for future use.
What do you think about supplements?
I love supplements. We use supplements because a lot of people have nutritional deficiencies and vitamin deficiencies. So it's best, of course, if we can get all of our nutrients from our food. That's ideal. But some people can't do that because of lifestyle or because maybe of gut health. They're not getting the nutrients that they need. So supplementing is important. And we're doing it in this targeted time period. So we want to use supplements to reach this goal and then let go of them if necessary. Usually we have people stay on supplements 3 months and we reassess. But we do want to give them this like targeted amount of nutrients that can be used to optimize sperm quality and fertility.
What advice would you give a couple that's just starting their trying to conceive journey?
Oh, um, I think I'm a fan of being proactive. I think finding out information is powerful. I also think that this is one part of your whole life, and however you can, if possible, and I know it's almost impossible, hold it as loosely as you can. It's gonna do wonders for your nervous system and your mental health. But I think finding out information is really great. So we always recommend people to get lab work, to get their baselines, whether that's your day 3 labs if you're the person that's carrying pregnancy, or and other hormone labs and just general health labs, or semen analysis and blood work is great. We want to know what people are starting at so that they're not wasting time. It's so often that people come to me and they've already been trying for a year, 4 years, 8 years even, and they find acupuncture and they're like, oh, I didn't know. Nobody told me that I should check this out or see if my tubes are open, or there's so many things that we can find out that will help to hopefully have this be a quicker process, not have so much suffering, find information, get connected, more connected with your body, and learn about your own rhythms. And then, if there is a problem, then you have tools to try to figure out what to do next.
Yes, yeah, I love it. Anything you'd like to add to encourage more open conversations around male fertility to at the end of this episode?
We talked about there's 2 ingredients. You hopefully can work as a team and just start those conversations. These are hard conversations. A lot of conversations that people avoid for years, or maybe just never even thought to have. This is an opportunity for bonding with your partner, and to get, like we said, on the same page if possible, and to really see what do you want your family to look like, and what are the ways that you want to go about building that family, and how can you work together as a team to make this happen, and to share responsibility that you're doing this together, and both people can do so much. When people are struggling to conceive, so much feels like it's out of your control, and there are these things that we have control over, and that for some people can be really comforting and feel like you're doing something proactive. So it's a good place to start, but I think just talking and having conversations is going to go a long way.
Yes, thank you. Thank you, Aimee.
You're welcome.